Dental bridges are a typical dental procedure that's employed to fill in the gaps left by missing teeth. They're designed to fill gaps caused due to missing teeth. They generally consist of several crowns which connect to the adjoining teeth that are on the opposite one side. There are many reasons a bridge for your teeth could be advised by your dentist. One of the main motives is to enhance the look of your teeth as well as the smile. The absence of teeth makes it difficult to chew or speak effectively, in addition to altering the alignment of remaining teeth. The dental bridge is a great option in restoring the natural shape and appearance of your teeth and improving overall oral well-being. Another reason that a dental bridge could be utilized is to keep the other teeth from sliding off their proper position. If one tooth becomes missing, the adjacent teeth could begin to shift into the empty space, leading to alignment issues as well as bite issues. The dental bridge is a great solution in keeping the remaining teeth in the proper position and ensure an ideal alignment of your bite. Dental bridges also aid to spread the strain of eating and chewing evenly over all teeth. When one tooth has been lost, the remaining teeth can bear more in the strain of chewing. This could result in wear and tear to the teeth. The dental bridge is able to distribute forces better and lessen the possibility of damage to the teeth remaining. There are many different kinds of dental bridges that could be employed, dependent upon the needs specific to the patient. The traditional dental bridge is the most commonly used type. They comprise two crowns, which are connected to the teeth adjacent, having a false tooth between. They are employed for when there's just one nearby tooth that can support the bridge. Maryland bridges utilize a metal or porcelain framework that supports the fake tooth. For an implant-supported dental bridge, the person usually has to go to their dentist at least once. At the beginning of each appointment, dentist will clean the teeth adjacent to them by taking away the enamel in a tiny amount so that they can make space for crowns. After that, they will make impressions of their teeth, which are used in the creation of the dental bridge inside a dental laboratory. In the following appointment, it will be adjusted and fitted for a comfortable size. It may be temporarily cemented in place for the patient to play around with it and to make any needed adjustments. After the design and fit of the bridge are acceptable, it is secured in its place. Following the installation of a dental bridge, it's important to ensure that the patient takes proper treatment of their dental hygiene so as to protect the bridge and adjacent teeth. That means flossing and brushing often, in addition to staying clear of sticky and hard foods that could cause damage to the bridge. Regular dental examinations are essential to make sure the bridge is healthy and address any issues that might arise. The bottom line is that dental bridges are a popular dental procedure that's employed to fill in the gaps of missing teeth as well as improve the appearance and performance of teeth. They may help in preventing the teeth remaining from moving out of place, help distribute the pressures from chewing and biting equally, as well as give the original design and shape of your smile. If you're lacking teeth and thinking about an implant for your dental, be sure to talk with your dentist regarding which option is best that meets your particular demands.